I have it bilaterally in all three branches, so the V1, V2, and V3 area, so it's kind of like this on my face, and it was miserable. I would wake up every day feeling like I got kicked in the face, and then intermittently would get electrical shocks through my face, and this didn't really let up, so I started kind of researching, trying to figure out what was wrong. At first, my primary thought I should see an ENT. They thought it was my sinuses. So first I had a sinus surgery. After that, the pain worsened. It felt like it was more consistent after my sinus surgery. After my sinus surgery, I went from there to going back to the ENT saying, hey, I don't know what's going on, but this is what I think is wrong. And they said, well, we think you might have TMJ. And I was like, I've never even heard of that. I don't even know what that is. Yeah. And then from there, I had an episode that was so bad. I was out to dinner with my husband in Temecula, and the episode was so bad that I ended up in the ER. My husband thought I was having a stroke. My speech was slurred. I was very confused. I didn't know where I was, what I was doing. When I got to the ER, I didn't even know how to tell them my name or my birthday or anything like that. I mean, it was completely just out of character for me to not be able to know any of those facts, and so it was alarming. And in the ER, I was treated by a team of professionals in neurology. So the UCR School of Medicine has a team of neurology students that were working as residents in the ER, and they're supervised by the neurologists at UCR School of Medicine that are actual neurologists. So one of the residents said, oh my gosh, I think you have trigeminal neuralgia. And I was like, what is that? And she's like, well, I don't want to scare you. We're going to get you to the best neurologist that's out here, and we'll get to the bottom of it. I said, okay. So I went in to her following my ER visit, and she was like, "God, sounds like you have trigeminal neuralgia. I'm going to refer you to somebody that's going to be able to help." So I was immediately referred to a neurosurgeon, and from there, took about 2 months, and I was in for my first MVD procedure, which
What's MVD?
It's a microvascular decompression surgery, which is a form of brain surgery where they go in through the back of your head near your ear, and they take out a piece of your skull, and they separate the nerve from the brainstem, which is what the issue was originally with my first time. So I had my right side done first, and then after my right side, I still had persistent pain on the left side. So they did the left side almost immediately coming out of surgery. When I woke up in recovery, I knew something was wrong. I told the staff, like, something's wrong. I need to go back into the room. they need to open me back up. Something's wrong. Now I'm in so much pain. And they told me, it's okay. Just let your body heal. And when they put me in the ICU, I told them, no, something is wrong. And they just all kept telling me to be quiet, stop making a scene, and just let my body heal and repair itself. And I pretty much knew for the next 12 months something was wrong. So at the 12-month mark, when they finally decided to reevaluate my pain, I told them, something's wrong. I am in so much pain. And they said, let's wait another 6 months. So I waited another 6 months in complete agony, having this pain every day, and occasional.
Describe the pain to me. Be specific.
It was just constant. It's like a never-ending brain freeze with electric shocks being sent through your face. And I'm a very active person. Yeah. I have 3 kids that are all, well, at the time they were all under the age of 10, and so this was debilitating for me. I was in bed. I had just no energy, because the energy that my body was taking to fight against what was happening was, I had no cups full at the end of the day. They were all spilt on the floor and nowhere to be found. So I had no energy to kind of face my day-to-day responsibilities, and that's where it became like a serious problem for me, and where I started looking for other options for relief. I did go through with the 3rd brain surgery to repair the left side. And that I was promised that, they would go in and fix it. Both of the first and second surgeries, my total time under was almost 12 hours on each surgery. So it was a very long time to be open, not your typical time that you would be open for. And my last surgery, I was only open for less than 3 hours, which was interesting, because it's almost like they knew something was wrong as well, and they maybe missed something. And I had contacted Dr. Ben Sutter in that time being, because I thought, you know what, there's got to be some kind of alternative. I had seen videos on YouTube and was really inspired by his patients who raved about DTR therapy, and I thought, that might be something I could try. But unfortunately, with 3 kids all in sports and my full-time job and my husband's full-time job and the distance between here and Oregon, it just wasn't possible at the time or plausible. And then with my 3rd brain surgery, I had lost my ability to walk. I went through a really difficult recovery. There was a lot more increases in risks when you go on the same side. The scar tissue is like one of the biggest ones, but you are a lot more exposed to risks as far as your cognitive function, and that's what I had the hardest time with. So I did do a lot of occupational therapy and physical therapy to gain back all of the skills that I had lost as a result of surgery. So it was a very long journey.
So 3 surgeries, 3 different brain surgeries. Over how many years was that?
It was 2 years.
2 years.
Yeah.
So you went through a 2-year period where you're trying to treat it.
Yes.
Got diagnosed about 5 years ago.
Yes.
And then last 2 years you've been trying to treat it through microvascular decompression surgery.
Because my body was also not responding to the nerve medications. I have gone through at least 10 different nerve medications that my body just completely rejected.
Okay.
So
every day, despite the surgeries, every day you were still having these electric shocks, electric pains going throughout the head and neck area. Is that?
Yes. So after my 3rd brain surgery, it was kind of like a Band-Aid. For a little bit I was feeling better, not 100% ever though. And then this April, so about 14 months after my last surgery, my pain came back with a vengeance, and it came back on both sides, and it scared me. And when I went back to my neurologist, they suggested that I get tested to see if I was sick, because it was possible that my sinuses were inflamed and maybe that was interacting with the nerve. After I finished my antibiotics, they said, we can refer you back to your neurosurgeon and see if they can help you. And I was like, no, absolutely not. I'm going through this a 4th time. It's harder the older you get. It's harder to recover from those surgeries, and it's also hard when you have a family, a job, and other responsibilities. It just makes it difficult to be able to do those. So by the grace of God, we found your office, and it was a miracle because it's an hour and a half from where we live, and it was just such a blessing to be able to find it in California and be able to have access to something like this. And broke open my safe and paid for the surgery. Well, used Cherry because that was a great first option, because I was scared about transporting cash this far down the road. But then immediately the next day paid it off, and that's been my journey. So
That's great. That's great. So tell me a little bit about our first visit. I remember you were in quite a bit of pain. You were really you initially came for a consultation.
Yeah.
Right,
Yes.
but then I was going to be gone for a week, and part of our we didn't want to hold off any longer, so we ended up starting that day, which is not something we usually do, but in your case we made the exception. Kind of tell me, refresh my memory again, share with me just a little bit about when you showed up at my office, kind of the state that you were in, how much pain you were in. Kind of tell me a little bit about that if you can remember.
I was in probably 10 out of 10 pain.
Okay.
I was miserable. I think you could see it in my face.
Yeah.
And I think a lot of my body language showed kind of where I was at. I'm just exhausted from all of the pain. And it takes a lot out of me to function. Yeah. And so I requested to have everything done that day, because I was like, I can't live like this anymore. It's killing me. And I wanted to see if it would provide any kind of relief, and it did. And that was like a huge miracle. Yeah. Like I said, the only pain I really had was the stretching of the muscles, because I think that was hard. But that also provided the biggest amount of relief for me. I think with those muscles being so tense, stretching them out and allowing them to kind of expand and get back to their normal place was huge for me, and it was definitely a deal breaker. Yeah,
that's great. Your pterygoids were very, very tight, and so we were able to actually release those. Kind of it hurt so good, or hurt so. Let's see.
Hurt so good but bad at the same time.
Hurt so good but bad at the same time. Hurt so good. I guess that's the expression. Yeah. But we were able to kind of relieve that tension and then get things back into place. Mm-hmm. And so 24 hours I called you.
Yes.
Tell me a little bit about what it was like waking up for the first time in 5 years without pain.
It was incredible. I woke up and I was like, am I dreaming? Like, I was looking around thinking, like, is this real? And then I looked for my kids because I guess I overslept and didn't take them to school. So that was nice. I got the best sleep of my life. And that was really nice. And I haven't had sleep like that in a long time. I'm constantly woken up by my pain. And especially when I'm having the shocks, I'm just constantly like, oh, like, because it's pain that just wakes you up out of a deep sleep. And it does affect your function the next day because you're just sleep deprived. And it's like having a newborn baby, except there's no baby. It's just sleep deprivation. But yeah, I woke up and I couldn't believe it. I was a little sore right here, but other than that, I was completely pain-free. I didn't feel like I got kicked in the face. I didn't have any sinus pressure or problems, which was huge for me because I haven't had that in over 5 years. It was crazy because I couldn't remember what life was like before. And it's hard because I've adapted to life in pain. And it made me cry because I couldn't remember like what life was before, like all the pain. So it was amazing being out of that pain because it's been so long I don't remember life outside of the pain.
Yeah.
So.
And the DTR was basically non-invasive, right? Yeah. I mean, it was not a lot of trauma. I mean, compared to brain surgery.
Yeah.
Right?
Yeah.
That's what we're comparing it to.
Yeah.
How long were we working, like, in about a little over an hour, maybe?
I got here at 2. I feel like I left at 5, but in and out because there were other patients. But so it wasn't that bad
kind of
at all.
Squeezed you.
Yeah.
But like as far as treatment time goes, you got
about
little
an hour
breaks, about an hour.
About an hour.
With breaks in between, and with any shots, any needles, any
no
any
pain medication.
No pain medication, no surgical incisions.
No.
It was all completely non-invasive. With just removing little bits here and there that we saw were interfering on our computer. Yeah. And that was about it. All you had to do was open and close, right?
Yes.
It wasn't.
And that was probably the hardest part because when it stretched, it was very, very tense. And I was like, oh my gosh. So, it was great.
Good. All right. Well, very good. So now what are you most looking forward to not being in pain?
Oh my gosh, living life, getting back to being present with my kids. I think I was so clouded with just, I can't do that, I'm in pain, or I don't know if I'm going to be able to do that. It was hard planning things because I wasn't sure if it was going to be a good pain day or a bad pain day. And that's the hardest thing with chronic illness. That's what trigeminal neuralgia kind of falls under, that umbrella of chronic illness, because you have good days and you have bad days, and you try to make the most of every day, but living under that pain and not being able to function is just, it's terrible, especially when you're a mom. Yeah. Your kids feel it, they see it, and they're like, oftentimes my kids will ask, like, Mom, are you feeling good today? And no kid should ever have to ask their parents that. And so I can't wait to just live life to the fullest with them.
Cool.
Again.
That's exciting stuff.
Yeah.
Is there anything else you want to share?
If you've been debating on doing this, do it. It's the best thing. And there's tons of videos on the interwebs about this therapy, and I believe in it. I think it works wonders. It's not guaranteed to be 100%, but it will improve your symptoms by at least 50% is what
that's what we talked about.
Yes.
And where are you at percentage wise?
I'm at 100%. Which is so it's insane. I mean, it's crazy. So awesome. I couldn't ask for more.
Cool.
So.
Well, thank you for sharing.
Thank you. Thank you for having me.
Cool.